Hi guys, in today's episode of Counseling in 3 Minutes or Less, we're going to talk about postpartum depression, but there was so much information to share that I had to go over 3 minutes. So sit back, enjoy, and let's learn about postpartum depression. Everyone experiences sadness in their life, but these feelings usually pass within a few days. However, 1 in 8 and sometimes 1 in 5 women experience intense sadness after having a baby. This is known as postpartum depression. Unlike the baby blues, which is sadness that occurs within every woman, usually 3 to 4 days after delivery, but no more than 2 weeks, postpartum depression continues beyond those 2 weeks. Sadness, including the baby blues, typically ranges from mild to moderate in intensity, and it typically resolves on its own. Postpartum depression feels more intense, lasts longer, and requires the support of a trusted mental health professional to resolve. If left untreated, postpartum depression can negatively impact your relationship with your newborn baby, and in turn can increase your growing child's chances of developing clinical depression and other serious mental health illnesses. It can also impact your child's ability to socialize with others and develop meaningful relationships in life. So now that you understand what postpartum depression is and how it differs from sadness and baby blues, it's important to know the symptoms of postpartum depression and who are most at risk and how to cope with postpartum depression if you experience it. Some of the symptoms of postpartum depression includes, but are not limited to, crying more often than usual, feelings of anger, withdrawing from loved ones, feeling numb or disconnected from your baby, worrying that you will hurt the baby, or feeling guilty about not being a good mom or doubting your ability to care for the baby. So what are some risks? Who are at risk of developing postpartum depression? There isn't much studies published that explains what exactly causes postpartum depression, but it is believed to be attributed to the sudden drop of hormones after you give birth. This is why all women are at risk of experiencing postpartum depression, but there are some women who are more at risk than others. These risk factors include stressful life events, low social support, previous history of depression, family history of depression, difficulties getting pregnant, being a mom to multiples like twins or triplets, being a teen mom, preterm pregnancies, basically giving birth before 37 weeks, pregnancy and birth complications, and having a baby who has been hospitalized. Postpartum depression can also occur among women with a healthy pregnancy and birth and who doesn't have history of any sort of mental health disorders in their life or within their family. So how do you cope with postpartum depression if you feel like that you're experiencing it? Well, a couple of things you can do. One is find time for self-care. You can also ask family and friends to help with some of your child care tasks, like putting the baby to sleep or bathing the baby or feeding the baby, maybe taking the baby to a doctor's appointment. You can also take long walks during the day while the sun is warm. You can find time in your day to exercise. Eat healthy and balanced meals. Refrain from alcohol or other substance abuse, including medical marijuana, as these increase dehydration, and dehydration increase depressive symptoms. Find time to rest more. And seek support from a trusted mental health professional. You can find a mental health professional in your local hospital. For example, Orlando Health's Winnie Palmer Women's Hospital hosts free weekly groups for mothers who experience postpartum depression. I hope I gave you enough knowledge about postpartum depression and hope that you feel more prepared for when you give birth and being a mother. Congratulations.